one one day or the other, we would be facing this hypertension, but some of us are actually facing. So this is a very important talk for all of us, and therefore we should make best utilization of it, especially when we have an expert here for 1 hour. And any questions you have, since the time is limited, she has to cover a lot of uh, slides, and your time is limited 45 minutes, and then we are planning 15 minutes. I will request all participants to post the questions in the chat box, and we'll take up the questions towards the end of the session. But if anyone has certain doubts about any specific slides, they can always use the reaction, the hand raise button, something like this, and then the question can be answered. I'd also like to point out that it is not an old age disease alone. I recently read a newspaper article in Kerala where it says that the cardiovascular diseases has increased exponentially especially in Kerala, which I was reading about. And many of those people now affected by cardiovascular diseases, their age ranges from 25 to 40 years, a comparatively young age. And it also said that 30% of those people who are affected in this young age, they are below 30 years of age. So this is actually taking us by a storm, and we may be ignoring it. We may not be giving due importance to it. And that is the importance of this talk. So with this, I hope you enjoyed the talk, and I will now hand over to Dr. Priya for carrying forward with the talk. Yeah.
I'll start sharing my screen. Thank you very much for the kind introduction and also calling me here for this talk. I hope after my talk of 40 or 45 minutes, I'm able to convince people that this is a killer disease and it is time that we get up and see what is happening. There are people who don't even know they are hypertensive. They think they are healthy. So it is a silent killer, and people who are hypertensive in this crowd, in the audience, I hope when they go back, they bring this lifestyle changes, which I would advocate. So starting my talk, when we talk about blood pressure, so pressure, it's a force. So what is blood pressure? So it's the force of the blood. It's forcing itself through the arteries. So the force generated by the blood on the arteries is blood pressure. Now, why do we have these two terminologies? Why do we call it as a systolic blood pressure and a diastolic blood pressure? What do we mean by that? Systole and diastole are medical terminologies. Systole means when the heart contracts and pumps the blood out, when it ejects the blood, that's systole. And diastole is when the heart relaxes and the blood fills in the heart. So what happens when the heart is ejecting? So ejecting means it is ejecting blood into the aorta and then into the big arteries. So it is ejecting in a force. So that force is systolic blood pressure in the arteries. And when the heart is relaxing, that means there is less force in the arterial walls. And that is why the systolic BP is always higher than the diastolic BP. And we all know it is measured in millimeters of mercury. So what do you call as high blood pressure? So for a layman, it's okay when we say that a blood pressure more than 130/80 is high blood pressure. But let's get into a little more of science. So as I said, if a normal BP means a BP systolic which is less than 120 and a diastolic which is less than 80. Now then what do you call it as elevated BP? At times people say, oh, today I have a blood pressure which is a little high. So that elevated BP means anything systolic less than 130, means 120 to 129, and a diastolic anyhow is less than 80. So this value of 80 is very important. Most of the people say, oh, my BP is normal, I have 120/96. That's not a good BP. Diastolic 96 is hypertension. That means when the heart is relaxing, still your pressures are high in the artery. So the most important thing which you all should know is that diastolic BP of 80 is the crux. You cannot have more than that and say that I have a normal BP. Now, when you say hypertension, there are 3 stages: stage 1, stage 2, and stage 3. So when the BP is less than 140 systolic, so something between 130 and 139, and the diastolic is less than 90, you say it's stage 1. When do you call it a stage 2? When it is 140 or higher. Higher means less than 180. So 140 to 180, pressure systolic, and a diastolic of 90 to 120. That is stage 2. And stage 3, which is an hypertensive crisis, which is an emergency. I repeat again, if you have a BP which is higher than 180 by 120, you cannot ignore it. You have to visit your doctor immediately. So how do I know that I have a high BP? Very clear, you have to get your blood pressure checked. That's the only way you can know that your BP is high, even if you feel that you're healthy, which means checkups are crucial. You should keep checking your BP. And if your BP is just elevated, it can happen that just lifestyle modifications may help you get your BP to normal. So what should I do when I'm taking BP and what I should not do? Like, you should not have a full bowel or bladder when you're taking BP. You should not have smoked or taken a strong cup of coffee or done a 30 minutes or 40 minutes of exercise and then you come and take your BP. Because if you do this, you're doing a sympathetic stimulation to your body. When the sympathetic stimulation happens, there is release of catecholamines like adrenaline, which will increase your BP. And then you will have a falsely elevated blood pressure. You may be having a normal BP, but because you took a coffee or you smoked, all that increased your BP. You should sit quietly 5 minutes before you take the BP. You should measure the BP at the same time, morning and evening. And supposing you have BP daily as say 130, 80, and suddenly you say, oh my God, my BP is 180, 90 today. Then you should repeat it and try to take the BP 2 to 3 times in an interval of 1 to 2 minutes. Now, don't cross your legs when you're taking BP. Feet should be flat on the foot. I repeat, why? Because when you cross your legs, your venous return, the blood from your veins comes up and there is an increase in the cardiac output, which will falsely elevate your BP. Now, most of us have BP instruments at home and we think that those are validated. Not necessarily. Not all BP instruments are validated, which means the BP which is taken by those instruments may not be correct. Now you have these, what you call smart watches, and in which you have blood pressures they are ideal. And you can connect them to software. So once you have a software connected to it, you can retrieve your data and you can show to your doctor that, yeah, this was my BP in the last 1 month. If you don't have it, I will ask you people who are hypertensive to take blood pressure twice a day, say morning when you get up, after you have refreshed yourself, before your breakfast, take your blood pressure. Once you come back from your office around 7, take blood pressure. Keep a chart like that for a month and take that to your doctor so that he can judge what medications are helping. Do you really need medications? So just going to a doctor and getting your blood pressure checked once and then calculating your drugs based on only that blood pressure is not correct. Now, what do you target is your blood pressure. If there is a risk of cardiovascular disease, I mean to say, if you are genetically prone.
I'm not getting volume there of this.
I think you should unmute
this.
You have to unmute.
What's that fellow Prashant? Nice showing. This is good.
There's somebody speaking behind.
What's his name?
Okay. So if you have a confirmed hypertension, you know that you are on hypertensive and you have a risk of a cardiovascular disease. In your family, somebody has died of a cardiovascular disease. Then your targeted blood pressure should be less than 130/80. But if you are not, if you do not have a risk of cardiovascular disease, you are less than 80 years old, you can have a target BP of less than 140/80. If you're more than 80 years old, your target BP should be around less than 150/90. Now, what about diabetes? These days, you see people who have hypertension and diabetes. So if you are 70 years or less, your BP should be less than 130 and 80. If you are a diabetic and your age group is between 70 and 80, your blood pressure should be less than 140 by 90. And if you're more than 80, as I told you, your blood pressure should be less than 150 by 90. Now, here I would like to say that if your blood pressure rises, your systolic by 20 millimeters of mercury and your diastolic rises by 10 millimeters of mercury when you are in the age group of 40 to 80, the risk of death from ischemic heart disease and stroke doubles. So how common is high blood pressure? It's the most frequent chronic non-communicable disease. It affects 30% of adults worldwide. And as Mr. Menon said, that youngsters less than 30 years, they are getting this disease. And you know, 2/3 of the people who are having hypertension are from the low and middle income countries. 46% are unaware, they don't even know, they think they are healthy. And those who are diagnosed, less than 50% are treated. And those who are treated, only 21% have a blood pressure which is under control. Let's look at the Indian data. This is a data from India, which came out in 2022 in a journal. And this data is between 2017 and 18. It was done from the Ministry of Health and Family Welfare. And this is talking about hypertension among people who are 60 years and plus in India. Now let's have a look at this graph. If you see, this is almost 28,000 people who were included in the study. And in that 28,000, 1% have stage 3 hypertension, which means they have a blood pressure which is more than 180, 120. 25% have normal pressures. Now let's go to the right side of the thing. So if you have, they measured that these people and they saw that 36% of these people, they came to know that they have hypertension for the first time when they were measured. Almost 30% were aware that they are hypertensive, but only 50% of them were treated. So what is this cascade? If you look at the cascade, control blood pressure in this study is only 27%. It's a very startling study that people who know they have blood pressure, but still they are not taking treatment. So we can classify hypertension in two ways. One is you don't have a reason. There is no reason, but you still have hypertension, which is called as an essential hypertension. Essential hypertension is because of your bad lifestyle, smoking, physical inactivity, alcohol intake. Secondary hypertension is because you have certain diseases like kidney disease, or you're born with certain problems with your heart, or ladies who are pregnant, they can have hypertension. People who are taking oral contraceptive, patients on steroids for some immunological disorders, and sometimes you have adrenal tumors in which the pressures are very high. So these are cases where you control the disease. If you take the adrenal tumor out, your pressures will get controlled. But primary hypertension is something which we need to discuss. There are two more types of hypertension, which is called as white coat hypertension and masked hypertension. White coat means when you go to a doctor and you see him, your blood pressure goes up. So this is a condition which is where the person at home has a normal BP, but he goes to a clinic, he's got a higher BP. And masked hypertension is just opposite to that, in which when the person goes to the hospital, he has got a normal BP, but when he comes to work at his office, he has got hypertension. So what should I be doing? How can I control my blood pressure? There's something which is called as modifiable factors, and there's something which is called as unmodifiable. You can't modify those factors. Non-modifiable factors are your genes. You cannot change your genes. Your ethnicity, as you grow old, and the sex of the person. So these are things which you can't modify. But there are certain things which you can modify in your life, which is your eating habits, your salt intake, your physical activity, your body weight, and smoking. So let's go one by one. You are not supposed to take salt more than 1.5 grams a day. 1 gram of extra salt per day increases your systolic BP by 5 millimeters mercury. Why is it happening? Like Mr. Menon said, that why these youngsters are having hypertension? Because of this fast food. We are so much into fast food, pizza, shawarma, and things like that. We don't even think that what is the content of sodium in that. So the first thing which you can cut back on salt is read the labels. Avoid foods which are high in sodium. Try to eat more whole foods, more legumes, more green vegetables rather than this processed food. Stop bakery items so that your salt intake, you'll see suddenly people say, oh, my pants have gone tight, my jeans are fitter, I've become a little more fluffier on my face, and my pressures are high. At that time, you should think that, is it because of my salt addiction? One more thing which I would like to tell is, these days we have seen a lot of dispersible tablets, with vitamin C, dispersible tablets. Then you have these antacids, some Digene tablets or Dispirine tablets, which you put in water and it disperses and you drink that water. These tablets contain very high level of sodium. So if you're a hypertensive or you are at the elevated hypertensive side, please consider changing this into a non-soluble tablet. Next is your body weight. I think most of us say, oh, my body mass index is normal. I am thin, I have a normal weight. My BMI is 23. But you have seen people who are thin, but still have a beer belly. They have a pouch. You have females who have a belly. So here it's not the BMI which is important. Important is waist to hip ratio. How is your waist? Look at this photo which I have put. Look at his belly. So if you even have a bit of belly, it means your visceral fat is more. Your fat around the internal organs is more, and that is very dangerous for your health. So the males should have a waist to hip ratio of less than 0.9, and the females should have it less than 0.85. If it is more than that, you are at a risk of having hypertension. Now, why are we so bothered about abdominal area girth? How does it increase the blood pressure? The deposit of fat and cholesterol happens in the arteries also. The arteries become stiff and thick. So when they become stiff and thick, what do? They use more pressure to pump the blood out. So the more the pressure they're building, the more stiffer they get. And along with that, there is increase in the secretion of catecholamines like adrenaline, which will increase the salt retention, increase the BP. Because the body thinks that there is less of volume in our body. Our brain thinks, okay, come on, increase more adrenaline. We need more volume. So that's how it's a vicious cycle. So what should I do? What should I eat? Have a healthy, balanced diet. Please eat right foods in the right proportion at the right time. You cannot have your lunch at 4 in the evening and your dinner at 1 in the night. Your body is not for that. You have a circadian rhythm. Your hormones, day and night, has been given by nature for some reason. You cannot eat at 2 in the night your dinner. And please avoid these Swiggy and Zomato, on all that style of food. Try to exercise. If you do a regular exercise for 1 to 3 months, say even if you walk 1 hour or 1.5 hours, or you do a 70 or 75 minutes of aerobic activity like jogging or playing, you will get down your blood pressure in 1 to 3 months. What about smoking? Somebody has rightly said, it's fire on the one end and fool on the other end. One cigarette produces immediate and temporary increase in the blood pressure by 5 to 10 millimeters of mercury. Why? Because when you smoke, nicotine increases the heart rate, and the nicotine starts depositing. There is narrowing and hardening of arteries. Smoking is one of the killers because it is increasing your chances of stroke, your chances of coronary artery diseases, and all sorts of lung cancer. So quit smoking immediately. And I can tell you that there have been studies which have shown that if you leave the cigarette today, your BP drops down to normal, and reducing the risk of complications, like I said, the stroke and heart attack. Now we talk about non-modifiable risk factors, genetics. If your family members are hypertensive, you will be hypertensive. That's in your genes. And we have seen that people who have their parents hypertensive, it's very easy for them to imbibe when you tell them, oh, you are hypertensive. They don't get stressed because they know that they will get it. In this study, which I had shown you from India, it was shown that in India, people from Assam and Andaman and Nicobar Islands are the most hypertensive. It may be because of their genes and also because they have high salt intake. And in Assam, in the tea plantation, people are used to eating this kheni, this tobacco chewing, which caused this study has shown. Now with age, as you age, the arteries' elasticity is lost. They become more stiffer. So blood pressure increases. Sex. Females have been lucky till the menopause that they are, what is this? So they're protected from the female hormones, from estrogen. But once menopause comes in, females are at more risk than males. About ethnicity, African and Black Caribbean descent, they have genetic predisposition, and also they have increased sensitivity to the salt in the diet. Why this is not moving? This is not moving. I can't move my slides.
You can just maybe exit and then reload it again.
No, now it is. Thank you. So next is stress. Today, even a 16-year-old is stressed. And stress leads to sleep disturbances. We all know when we are stressed, we cannot sleep. Half of the people now start taking Alprax and all that to sleep. So insomnia is linked to an increased list of high blood pressure. What is sleep apnea? I think most of you must have heard this term. Sleep apnea is when you sleep and you are unable to breathe. You get up, you take a breath, and then again you sleep. And your wife tells you that you snore a lot in the night. Why does this happen? This is seen mostly in obese people who have a neck circumference which is high. There is much fat deposit. So when you sleep, all the muscles are relaxed, your tongue falls back. When the tongue falls back, there is choking, you're unable to breathe, you get up. So this cycle of low oxygenation in the blood, and because you're not able to ventilate, the carbon dioxide is high in the blood. You are sleepy in the day, you sleep, when you're working, you are sleepy in front of your computer. All this leads to hypertension, and there's an increased risk of heart disease in these people. What you can do for this? You can use a CPAP machine, which will help you to manage the BP here. So what do I do for my stress? Get some exercise, do some meditation, get enough rest, talk to people whom you love, join some laughing club, listen to some jokes, and don't be afraid to ask for some help. Go to a psychologist if you feel that you are stressed. Now, what are the symptoms? Our title was that it's a silent killer. That means you don't have symptoms. Or you may suddenly have a symptom like blurred vision, I'm unable to see, or I have a throbbing headache, or you come with a cardiac problem, you have chest pain, you have angina. Or you will see that when I get up in the morning, my ankles are swollen. And then you will say, no, I worked a lot yesterday, or I wore a tight shoes. You don't think that these are some warning signs for you that maybe your blood pressure is high. When the blood pressure is high, what happens to the heart muscles? Now, people who go to the gym, they know that when they exercise their biceps, they become hypertrophied. They try to show their biceps, see, my muscle has come up. Similarly, when your heart is pumping against a resistance because the vessels are narrowed, the heart is pumping against these narrowed vessels, the heart muscles also becomes thick. So the cavity of the heart becomes smaller and the muscular part becomes more. And this is a vicious cycle. So the heart, this is called as hypertensive cardiomyopathy. People who have long-standing hypertension and they have not noticed it, they at times come to the hospital with a cardiac arrest, and we see that this person has got a very stiff heart. So as I told you, complications can be a brain stroke, sudden vision loss, heart attack, kidney diseases. Now, what is bone loss? Now, you people will think how anybody can have a bone loss with hypertension. When a person is hypertensive, he loses calcium in his urine. We don't know. We never go and check our urine calcium. Now, when the calcium is being lost in the urine, the serum calcium is less. So the body thinks, oh God, the serum calcium is less. I have to get it normal. So our parathyroid hormone starts working. It releases the parathormone, and the parathormone acts on your bone, and from your long bones, calcium is taken to the blood so that the blood level of calcium remains normal. And if hypertension is controlled, one can reduce the risk of high cholesterol, diabetes, lung cancer, and heart disease. So now how to manage? So you have a blood pressure, which is 130, 80, or less than 89. You do not require a drug treatment. You can just have a lifestyle change, which can help you. What lifestyle change? Reduce your salt intake, maintain a healthy body weight, be physically active, stop smoking, limit your alcohol intake, eat balanced diet. So these are modifiable things, and you don't need drugs. But if you need a drug, this is stuck again. Okay. So there are WHO guidelines which tell you when to take the drug. So if you have a BP, which is confirmed systolic more than 140, diastolic more than 90, you need to have a pharmacological treatment. You need to take medications. What about patients who have a blood pressure of 130 systolic, but they have an existing cardiovascular disease? You need to start medication. If you don't have a cardiovascular disease, but you are at high risk, which means you have a diabetes or you have some chronic kidney disease, then you need to start medication even when you have a blood pressure of 130 to 139. So, do I need a lab testing before I start my medications? When you go to a doctor, he will write a big list of lab testing for you. So you think that you require that? WHO suggests that you should do it to see if you have a secondary hypertension, but that should not cause delay in starting your treatment. What about looking at the risk assessment for cardiovascular disease? Of course, WHO says that you should do that, but only if it is feasible. That means if you are in some small village in Bihar and you have gone to a doctor and he says, oh, your BP is 150 by 90. You will not wait that some cardiologist visits your place and he looks at your cardiac this thing. No, you start your medication then. So what is the guideline for treatment? There are 3 classes of treatment drugs which can be used. One is thiazide. Thiazide is a diuretic. Diuresis means it increases your salt and water loss from the body. Then there is something called as angiotensin converting enzyme inhibitor and angiotensin receptor blocker. These are the medications which act on an enzyme link, which induces some hormones, which increases the BP. So once you do this, they inhibit that link, they block that link, and that is why the BP is controlled. And then calcium channel blockers. So how do I start this medication? Instead of using a single pill, say you take calcium channel blocker in the morning and then you take, say, beta blocker in the evening, they say it is better that you have a combination therapy because it helps to improve adherence. And you have to choose the combination therapy from these 3 drugs. Now, few people who are in the audience may be thinking that I don't take these medications. I take something in this list. You may be on prazosin, you may be on phenetolamine, you may be on metoprolol. So these beta blockers are also used in patients who have a heart rate also high and whom some people get cough. You know, when you start AC inhibitor, you have a very terrible cough. So, or you develop edema in your legs. So such people, then we switch on to beta blockers. Then all the other drugs in the last one, they are mostly for secondary hypertension. Now let's talk about hypertension in highly competitive organizations like Indian Oil Corporation. This is one of the most common problems which is faced by working people. You people are working in a highly competitive thing. You have targets to meet. You people don't sleep in the night. You don't have a leisure. You go out with your family for a movie. Your phone keeps ringing. You go out. You have increasing work stress, no leisure. What happens? This is not going to increase your business performance. It is going to decrease your productivity. For this, I got this study, which is from a multinational oil company in Nigeria. And they looked at around some 250 officers who were working in this oil company, and they looked at blood pressure categories using two guidelines. One is the AHA guidelines, that is the American Heart Association, which says the cutoff for hypertension as 130/80. And the other was their local guidelines, which they said 140/90. Now have a look in this. These are some 235 odd people. You see that 72 of them are normal blood pressure. But if you look at the AHA one, you see 35 of them have elevated blood pressure. And you see, if you look at the JNC guidelines, you see almost 40% are in the stage of pre-hypertension. So then they looked at it. What is the cause? So if the blood pressure is said that if it's more than 130/80, it is hypertension, they saw the risk factors were male gender, age, family history of hypertension, increased body mass index, physical inactivity, and a fasting blood sugar level, which was high. And they looked at their cardiovascular risk. This is a score which we called as Framingham risk score. It tells you how much is your risk of having a cardiovascular problem in next 10 years. And they saw that 5.5% of these people had a high risk and 16% had intermediate risk. What happens when you have hypertension and you continue coming to work? And abstinism. Hypertension is one of the most frequent cause of people taking sick leave, which means there is loss of productivity. Now, once the productivity is lost, you think, I have to sit, I have come today after 5 days of holiday or taking a sick leave, my productivity is very low. I should sit long hours. This causes more stress to you. It is bad on your health, and it's a vicious cycle. And it lowers your morale also. So most of you, I'm sure, they know that they have to do something, but they are not ready to act. They are just casual. So what can the employer do? Here comes that the employer needs to give a prompt feedback. He needs to do some triggers to see that the employees do something for their health. What can you do? You can have regular health fairs. You can have specific programs on stress reduction, smoking and alcohol cessation. You can encourage people to participate in physical activities. Why do you need a lift? Why don't you climb stairs? Why can't you meditate for 5 minutes or 10 minutes? Have some yoga sessions. Do some routine stretches at your desk. In your canteen, why do you allow your cooks to use so much of oil? Why can't you have a balanced diet? Your office canteen should serve healthy food for meals. Get sugar-free options for tea and coffee. Get regular health checkups. Get a gym into your workplace or give discounts on fitness club membership for your people. Put self-monitoring stations, get blood pressure screening kiosks in your workplace, and see if somebody is doing good. Make him a mentor, make him as an example so that people are motivated. Why am I talking so much? What will we achieve if we control our blood pressure? If you get a 10 millimeter reduction in your systolic BP, I'm not talking about diastolic, in a systolic BP, 10 millimeter reduction will get a 20% reduction in the risk of major cardiovascular disease events, 17% reduction in coronary artery disease, 27% reduction in stroke, 28% reduction in heart failure, and the all-cause mortality decreases by 13%. This I'm talking only if your systolic BP is coming down by 10 millimeters of mercury. So here I would like to put the key points. Our urbanized lifestyle has not done good on us. We are eating high energy diet, full of trans fat, full of carbohydrates, full of sugars. You get a pizza with a Coke, and then you sit and watch Netflix. So high energy diet with low level of physical activity, leading to overweight and obesity. And then you have weekend parties where you smoke and consume alcohol. In India, hypertension control is lower among men as compared to women because you don't go to doctors, you don't listen to the consultation. Your diet, poor adherence to the diet and the medications. If you're supposed to take a medication at 8 in the morning, you forget and then you take at 11 in the morning. You have unhealthy behaviors like smoking, drinking, and all this leading to a sedentary lifestyle. I will just tell the employers that employees are the most valuable resource for any organization, and safeguarding their health should be a priority. I thank you for your patient hearing. Any questions?
That's definitely a wonderful presentation. And before we take up the questions in the chat box, are there any direct questions? If anybody wants to unmute and ask questions, you are welcome.
Employees may please unmute.
Excuse me, ma'am. My name is Subramaniam. I want to a question. My father, who is 69 years old, actually he eats a lot of salt, but he never faced this. And I am using moderate salt only, but my blood pressure is already 130/80. I am 37 years old. So my father eats actually almost double the salt which I eat. Means I have
the size?
My father eats double the salt which I eat. Even like after cooking the any Korean dal also, in the food also he puts extra salt. So is it hypertension is directly related, and other things like genetics or any other things are also there?
Okay. So let me ask you, what does your father do? What did he do when he was a youngster?
He was used to work in a cloth shop as a gumasta, like helping person.
So what his physical activity was much more than you in his young age.
Yes.
So his heart and his vessels, they are used to that physical activity. Compare your physical activity with your father at the age of 37. He must have done cycling. You must be taking a car or a bike. Exactly. Okay. Your father must not in Tamil Nadu or from wherever you are eaten pizza and taken cokes, but which you are doing, right? So you are very young. At age of 37, if you are having a blood pressure, you need to wake up. Lose weight. Lose weight means your BMI may, I think your BMI also looks a little higher, but definitely your waist to hip ratio is more. Please get into your physical activity. Cut down on your salt. And as I told you, keep a chart of your blood pressure. Your lifestyle changes, because you're so young, lifestyle changes will help to get your blood pressure normal.
High diastolic pressure and normal systolic pressure. What is the reason for this? Like my recently when I measured my BP, the upper side, the systolic pressure was normal. It was 118, but the diastolic was elevated. It was around 86, 87 or so. What is the reason for that?
Very good question. So when you have 100 and say 118, we make it 120. So you have 120 systolic and you have a diastolic, which is almost reaching 90. Followed? 89 or 87 or whatever. So your difference between the systolic and the diastolic is very less, which we call as mean arterial pressure. So the mean arterial pressure is high, which means your vessels. How is your cholesterol levels?
I have not measured it recently, madam, but probably 1.5 years back when I had measured, it was slightly on the higher side. Yeah.
That's it. That's it. So please, you should tomorrow itself on your empty stomach, go and measure your total lipid profile. And please see how much is your HDL and LDL. Your LDL should be less than 70 and your HDL should be more than 50. And so your diastolic pressures are high because your vessels are getting cholesterol deposits. The heart, when it's relaxing, also your blood vessels are not relaxing. They are stiff.
We are also having Mr. KK Sharma sir is here. Welcome, sir. I mean, nice to meet you after some time.
I just
All right.
joined a little late. I have one query, madam. Very good session. I could attend part of it. I am a diabetic for last 20 years, but I don't have any blood pressure issue. I have one question to ask you between food regulation, exercises, and stress. Which is the main killer for blood pressure?
Food and stress?
I am saying the food regulation, the exercises, and the office stress. Which one is the more harmful?
See,
If you violate on food, if you violate on exercises, or if you have office.
See, these are combined things. You cannot say, okay, I will eat every day one big pizza and then I will go and exercise. It's nothing like that. And if you say you exercise and you don't eat bad, but you have ample amount of stress at your place, that means your adrenaline is always on the higher side. So once your adrenaline is on a higher side, adrenaline is an anti-insulin. So your sugars, even if you don't eat properly and you exercise properly, your adrenaline in the body will dampen the insulin which is in your body. So you will have high sugars and you will still have a chance of getting hypertension.
Any solution, simple solution for people like us?
For what? For diabetes?
I have a stressful job.
See, I also have a stressful job. I work for ICU. I work, like COVID was the most stressful thing. But we have to keep, that's something you have to see, that your mind and this thing is not your, see, if you have a body, if you are alive, then only this job is there. If you're not alive, where is a job? Company. I thought during COVID that if I die, who is going to lose? My husband, my family. So we have to start thinking about ourselves. And I'm so amazed to see that youngsters these days, like you must have read in papers that 30-year-old suddenly died. He was cycling, or he was doing some cardio, or he was playing some cricket. So why is this happening? Because of our very poor lifestyle. We are urbanized. Our parents, they are still there till 88 and 90. They can still walk. And we can't climb up stairs. 4 stairs we climb and we start becoming dyspneic. So we need to change ourselves. Jobs, see, after 60, you will retire. But then you will be having a big bulk of diseases with you. Do you really want to enjoy your life post-retirement like that?
Obviously, no.
Yes. So it's you who has to think what to do.
Yeah, there's a question. There's Vikas Chandra has raised his hand. So meanwhile, a comment has come. One of the best sessions ever attended. Nice, simple, clear presentation. Do share the slides if possible. Eye opener. Thank you. Yeah, Mr. Vikas Chandra.
Good afternoon, everyone. Good afternoon, ma'am. Ma'am, I want to know, suppose we have somebody has a chest pain. Now, how do we distinguish whether it is due to some gas or some trouble with the heart?
Exactly. So now I cannot say that this age group, if there is chest pain, because now because we are getting patients with heart attack at age of 22 also. So if you have a chest pain, you have to go to a doctor and not say this is gas, because if you have a right coronary blockade presents like abdominal pain, gaseous distension. Huh? So if you have a chest pain, it can be a gallstone, it can be a kidney stone, it can be gas, it can be some costochondritis, it can be anything. But if 1% chance is that it's a heart attack, then you lose your life. So it's better if you have a chest pain, you should go and see the doctor.
Hello, ma'am.
Yes.
Ma'am, one more thing. Once I was returning from a marriage party in the evening. So I walked down I had to walk around half a kilometer to my residence. So while coming back, walking down, I felt some breathlessness and some sweating also. And I was not able to walk maybe 50 meters also. So after 50 meters, I have to sit down, take rest, then again continue. So what could be that the reasons, underlying reason for that?
How old are you, if I can ask you?
I have 44 years.
And any habits other than your stress at work?
No, nothing.
No smoking, nothing.
No.
You never smoked in your life,
No, no, I'm not smoking.
and you're a teetotaler. You don't drink.
No, I don't drink.
Okay. And is there a family history of any hypertension, any cardiovascular risk factors in your family?
My father has hypertension. He takes medicine for that.
Yeah. And when did you get after you had this dyspnea, and what did you do? Did you go and meet a doctor?
No, I didn't go and meet doctor.
Yeah. Then this is a warning sign that you should go and meet a doctor. It's quite possible, because your father has hypertension. It's quite possible that you may have. Please cut down your salt intake and start exercising.
I'm told to prepare one small write-up for why it is his signature is required. Okay. And we'll put up my name, you sign, Ashok sign, and then we'll, so that we'll also aware. Like
I would request participants to kindly mute themselves who do not have a question. And going forward, I would also request participants to please ask one question per participant, because we have a lot of questions and we are taking ma'am's time. Nirmal sir, you have.
Ma'am,
Yeah,
one query I have.
I have a question. Good afternoon, ma'am, and good afternoon, others. I am 56 years old. I don't smoke and I don't drink. And till 4-5 months back, I had BP 140/90. And now I'm getting 120/80, 118/77, something like that. Okay, last 3-4 months I'm seeing that. Okay, and earlier I used to take BP medicine, and I visited a doctor. Then he's saying you continue the medicine. Should I continue the medicine? And I don't smoke and I don't drink.
So my question, this blood pressure you used to check morning and evening, this was a full 1 month before you went to the doctor? It was just the doctor who took that blood pressure at that time?
Doctor took the measure, and also means not every day. Weekly I used to take the
no
measure.
See, but you are taking this blood pressure when you are on a medication, right?
Yeah, right.
Yeah. So if your blood pressure is controlled because you're taking a medication, that means it's a medication which is helping to control your blood pressure, right?
Mm-hmm. And I stopped medicine without informing doctor for 2 days, and then also I took the measure. Then also it is.
No. Please don't stop medication without your doctor. Keep your blood pressure. I told you morning, evening, keep checking, and then make a table, go to the doctor and tell him that, okay, I stopped this medication for so much of time, and this is my this thing. See this number, what I told you, 130/80. And if you have any family history of any issues, then you should be 130/80. You have to continue your medication.
Okay.
So
no,
please make a chart morning, evening. See,
okay.
Blood pressure has a diurnal variation. Morning blood pressure is not the same in the afternoon, and afternoon is not the same in the evening. So if you think that my blood pressure in the morning was 110/70 and it is normal, maybe in the evening when you come back from office, it's 150/90. So take a different intervals and then make a chart and go to your doctor. But don't self-medicate and don't stop medication.
Okay. There is another query. I mean, Mr. Baidya has raised the hand. Mr. Baidya, you can unmute yourself and then speak. You are not unmute. You are not audible, Mr. Baidya.
Sir, we are still not able to hear you.
All right. Meanwhile, we can take the other question. The name is not known. 000300188. You can identify yourself and ask the question.
Good afternoon, ma'am. Ma'am, I am Smita Sachdev from Pipeline Head Office. I just wanted to ask one question, that once the BP medicine is started, and I have been on a long-term medication for this BP medicine. So the doctor said not to discontinue the medicine even though the BP is under control. So is it to be taken lifelong, or any possibility to avoid the medicine?
Can I ask your age and from what medication you're taking?
Ma'am, I'm taking Telma 40 and Beta Cap TR 40, 46 years.
And this is after your pregnancy blood pressure started, or it started all of a sudden?
No, it started around 10 years back, post pregnancy.
Yes.
That was not a case.
Yeah. So this has started post pregnancy, right?
Yes, ma'am.
What is your weight?
Around 60.
So what is your BMI?
I have to see, ma'am.
Okay. So the thing is, see, I think you, after your delivery, this blood pressure started. That means you had gestational hypertension is what we called. I didn't speak about that because it was not required. Day for at least a month. Don't stop your medication. With your medication, keep writing this BP because your BP is controlled because of the medication. And then if your doctor says stop the medication, you cannot stop both the things together. You're on a beta blocker and you're on a telmisartan. So then one drug can be stopped. And then you measure your BP. So it has to go gradually. You cannot just all of a sudden one day stop all your medications. Yeah, because you're 46, so you're approaching your menopausal age. You followed?
Yeah, okay, ma'am.
Thank you.
Thank you, ma'am.
Good afternoon, ma'am. Good afternoon, ma'am. I am Vikas Das from Mathura Refinery.
Yes, please.
Actually, I want to ask you one question.
Yes,
How can we control LDL and to reduce LDL, and how we increase our HDL level?
Very good. So please don't go by your laboratory, this thing where they write that LDL less than 110 and HDL more than 45 or something. These are European and American standards. We don't have any standards for Indians. Our coronary vessels are very small. Our genetics are different than the Europeans and Americans. So our LDL level should be less than 70 and our HDL should be more than 50. That's the first thing. So to increase the HDL in diet, see, coronary artery disease happens when your HDL levels are low. LDL is a culprit, but if your HDL levels are low, you're sure to get a coronary problem. So increase your fiber diet. How can you increase your fiber diet? Use things like isabgol, which is fiber, pure fiber, grass. Drink 1 spoon in water every day at the night. You are increasing the bulk. So what happens? The oil is sucked into this. Stop. If you're a family of 4, your oil consumption in a month should not be more than a liter. That means 250 milliliter for 1 person. Cut down on your oil. Only diet can help to increase the HDL and get down your LDL. Nothing else.
Ma'am, if I used to take oats and almond, whether
That's okay.
it will increase HDL level?
Yeah, but see, anything which you eat, anything, that should be to a proportion. You cannot say that I will eat 20 almonds in a day. You take 5 almonds in a day, which will help. Excess of anything is bad. So if you're taking oats in milk and you take full fat milk, that's not good. So try to see, that's what I said, read your labels. See what is the content, how much is the protein, how much is the fat in this milk. Is it good for me? This is my LDL level. How can I cut down on my oil? So you people need to change your lifestyle. Even if you go for a marriage party, you cannot say, oh, today I can eat. It's just one day I'm cheating. You have to incorporate into your lifestyle.
Well,
Ma'am,
there are
one small question. Sorry for interruption. One small question about the salt intake. What about the rock salt? Replacing the white salt with the rock salt and black salt is equally bad?
Everything is sodium.
Okay.
Everything is sodium. Everything will retain water. If you eat rock salt or what are the salt you said?
Black salt.
Black salt. Okay. Try eating that and see if you eat it like one little bit and eat, and you will have to drink water. What does that mean? It means that there is sodium inside that.
So both are equally bad.
Yes. Any salt you take, you should not be taking more than 1.5 grams a day.
1.5.
All right, we can take only a couple of questions, then we'll have to see some questions from the chat box. So maybe those who raise hand, Hazira from Hazira Lab, Madam 502422. Can you speak? You are not audible. You can switch on the mic.
Good afternoon, ma'am. Cause of hypertension is OCD. Is also cause of hypertension.
OCD?
Yes. So
yeah, it can, because anything which gives you stress can cause hypertension. Anything which gives you stress.
once it is over, then we'll say.
Okay, Mr. Mr. Dinagaran, you have raised the hand. Is there any question from your side?
Actually, madam, Dr. Madam, good afternoon. One of the reason symptoms you said that blurring view. Okay, eye view. See, how we can differentiate blurring eye view and the giddiness? Is there any sort of?
See, blurring of vision, see, when you're giddy, your head will start rotating. You need to sit, hold somewhere. Blurring of vision means you're suddenly unable to see things. You don't become giddy. You suddenly feel that you are unable to see. It's like fading of vision. It is like your glasses are filled with some moisture or something and you're unable to see, but you're not giddy.
Okay. So point is that that blurring of vision will be there for a moment, or it will be for.
See, it depends. Blurring of vision can be for a moment if there is just a spasm of the retinal artery, the artery of your, and total loss of vision can happen if the retinal artery, because of the high blood pressure, bursts and there is retinal hemorrhage.
Okay.
So blurring of vision is a warning sign that you should wake up.
Okay, some of the questions we'll take from now the chat box. Some selected questions I'm taking because absolutely there is no time. So we'll have to be very selective. So whatever is covered by the doctor, I'm not taking. So one question is, I've been asking Amlong 5 milligram. I've been taking Amlong 5 milligram for the last few months after being diagnosed with high BP in September 22. Now swelling is noticed in feet at times. Is it due to the medicine?
Yes. Yes, it's a calcium channel blocker. Yes. You can go to the doctor and he will change the medication. But you should keep a record of your blood pressure before you go.
Okay, then are there digital BP machines at home measured to measure BP correctly?
See, I cannot, as a physician, I'm not supposed to take the name of the companies. That's conflict of interest. You can go and speak to your doctor.
After stent, will BP decreased or remain at the previous level?
After what?
Stenting.
What is stenting?
Stent.
What is stent?
Sandeep,
heart to stent.
How stenting? Okay. Stenting. After stenting?
Will BP decreased?
See, after stenting, you have stented the coronary vessel. Now, if you have a blood pressure because all your arteries in the body are stiff, it's not going to affect anything. It's just that your coronaries, which were blocked, the doctor has opened it. So your heart is getting blood. So it has nothing to do with yeah, of course, if the doctor has started medications for hypertension after your coronary issue, your BP will be under control. Otherwise, there is no this thing that if you put a stent, your BP will get controlled.
Okay, then okay.
I will take this question for Mr. Vaidya. He said he has been diagnosed with HOCM with a pressure gradient of 76. So, Mr. Vaidya, HOCM is hypertrophic obstructive cardiomyopathy. I don't know what your echo states, if there is any mitral regurgitation, if there is any SAM, but I'm sure your doctor must have advised you about septal ablation. Your septum is very thick, and the thick septum needs to be cut out. So they will ablate. The cardiologist can ablate it, or a cardiac surgeon can cut that septum. You need to do it because HOCM is it's not that I want a fear to come into AO, but it's one of the most important causes of sudden cardiac death. So please do what the doctor is telling you.
There is another question from Mr. BC Jain. I am on BP medication for a couple of years, but sometimes my BP suddenly increases and fluctuate a lot, 180 by 110. What may be the probable causes? Doctors have added any.
Yeah, you need to get your ultrasound. Please get your ultrasound. Look at if your renal artery has a stenosis, and you need to change your medications. Your medications are not proper. They need to be properly handled. Maybe you need more.
He's saying the doctors have added an extra Telma 40.
Yes, yes. So they have added, but as I told you, please keep a month of your blood pressure chart and then go to your doctor, and he will be able to adjust your medications.
All right. There are so many questions. We won't be able to take all those questions.
You can send all this to me and I will answer.
Yeah, yeah. So we can do one thing. Can I give the email ID?
You take and send.
Okay, okay. So you can send the email, your queries to me. I'll put in the chat box. You can send the any queries you have. Which we could not cover in the current session. You can send to me, and then I will send it to Dr. Priya. So in the subject, please mention that it is a query related to hypertension, so I can understand what it is, and then we'll send it to Dr. Priya. So I mean, it was really a fantastic session. In fact, we have almost 580 participants. That is few less than what the session we had earlier with Sister Shivani. It's a very well appreciated session. Since the time is limited, so we'll have to close now for Priyanka. So closing words from you.
Thank you so much. Priya ma'am, thank you so much. We know that right now Priya ma'am is also experiencing some discomfort, just for the knowledge of the participants, and she's.
No, I fractured my bone, my leg bone, day before yesterday. So I'm walking with crutches now.
And ma'am, in this condition also you have agreed, to.
Because my husband had promised, so what to do? So I took.
Anyway, so that shows the commitment. Yeah. Yeah.
We are very glad that you could actually come and talk to our participants. They had so much of queries, and even to the general, employees, the public that have joined. It was really an eye-opening session, as one of the comments had also, somebody had written that it is so informative, it is excellent, and it is eye-opening. So now we also need to gear up to take care of our health, and in very simple words, in a very relatable way, ma'am, you have told us. So thank you so much, ma'am. And from all of us, we would wish you, that you get better very, very soon. And we can again see you.
My husband can come get some leave for him, and he can come and serve me a little here.
So there are so many get well soon messages. So I hope you
thank you.
get well soon.
Thank you so much. Thank you so much.
Thank you
And
so
for
much.
the information of participants, we are going to have an ongoing upcoming session on parenting. That is on Saturday. That's the last of the parenting sessions at 10 a.m. on Saturday by Dr. Gargi Sandliya. I'll request a participant to join for the session. We'll share the Zoom link on Friday, and that is going to be a very interesting session also. So thank you for all participating in this nice program, and hope to see you soon. Thank you.
Thank you so much. Namaste.
Thanks, ma'am.
Thank you so much.